We're going to turn things over now to hearing a little bit more about what various faculty in our department are doing, and that'll give you a little bit more of an idea of some of our own research expertise and some of the specific areas that we focus on. So thanks, everybody. And again, contact me if you have any questions or anything like that. I'd be happy to address them.
Thanks a lot, Barb. I mean, this was very helpful for people here to know lots of information in the details about the programs. Again, our website, please go to our website. All this information is all there and more. So we're going to change gears a bit and go to our faculty. So just a quick note. So we're pleased to have all of our continuing faculty here. We have many other adjunct faculty, sessional instructors who teach many of our courses as well. But right now we'll hear from our continuing faculty. Each of them will present their research topics, taking a few minutes each. So I suggest that we go with this order if we can. So why don't we start with Andrew Wister, and then Andrew Sixsmith, and Atia, Barb, Mitchell, Teddy, and myself. So let's follow this order. Okay, so we'll start with Dr. Andrew Wister.
Very good. Welcome, everyone. Nice to see such a terrific turnout. I've been told that I have 2 to 3 minutes, and if I go over, they're going to cut my microphone off. So I'll try to be succinct. I'm a professor in the gerontology department. I've been professor since 1991. I'm also the director of the Gerontology Research Center. The center is a separate unit from the department, but there are very strong synergies and connections a number of ways related to research. In fact, many or most of the faculty are connected to the center in one form or another. If you're interested in seeing the kind of work we do, please visit that website, the GRC website. And again, it's a separate website. I'll mention 2 major projects that we're involved in. One is the Canadian Longitudinal Study of Aging. We're one of the national sites of this major study following 51,000 people aged 45 to 85 for 20 years, the same people over that time period. So there's a wealth of information that's being collected. As well, we have 4 funded COVID studies, and you can find out more about those on the site. With respect to my own research, I have interest in a number of interlocking areas, covering baby boomer health dynamics, social isolation of older adults, resilience, especially multimorbidity resilience and aging, and family transitions. Barb and Loon Lai, one of my postdocs, and myself have published, or at least have in press, a recent article that examines the effect of caregiving on social isolation. It's a very interesting piece. I have work that I've published recently with Teddy and Barb on multimorbidity resilience and health behaviors and how those affect the ability to bounce back from the adversities imposed by concurrent chronic illnesses. I've also been working in the area of health policy reform, integrated care models. I think that was mentioned with respect to one of our PhDs, and a number of other areas that I have interest in as well. In the department, I teach health promotion courses, statistics courses, and some substantive areas such as health and aging, or health promotion and aging. Thank you.
Thank you, Andrew. So we're going to move on to Andrew Sixsmith, Dr. Andrew Sixsmith.
Thank you, Habib. Okay, so I'm Andrew Sixsmith. I'm professor in gerontology. I'm also the director of SFU's Science and Technology for Aging Research Institute, which is a multidisciplinary cross-faculty institute that focuses on technology and aging. And I'm also scientific director of AgeWell, which is Canada's age tech research and innovation network. I'll talk a little bit about that. From what I've just said, you can probably guess that my particular interest is in the connection between aging and technology. Habib started by saying that we're in an increasingly aging world. at the same time, we're in an increasingly technologicalized world, if I can use that word. You know, so much of our lives now are mediated by technology. You know, to the extent that we, as well as talking about, say, social determinants of health and well-being, we can also talk about digital determinants of health and well-being nowadays. So this is a really crucial emerging area, and probably has not had the kind of attention within the field of gerontology over the years. So AgeWell is really pushing this agenda nationally, internationally, and here in BC. It covers a wide range of areas, so health and healthcare delivery using technology is obviously an important area, but it also covers other areas such as technology in the workplace, employment, financial wellness, that kind of thing. So it's very wide ranging, as you might expect. I wanted very briefly just to mention a few things that are relevant here at SFU, which would be valuable for anybody who was coming to be part of our grad program who has an interest in technology and innovation. So for example, the STAR Institute that I just mentioned really has very, very strong international and national and local connections. For example, a lot of connections with local community organizations who are interested in technology-based solutions. I teach a specific course, a grad course at Gero 830, which is on innovation and aging. I just want to highlight that it's not necessarily just about technology. We're thinking about innovation here in a very, very broad sense. So for example, maybe changing the way we think about aging. You know, we often think about older people as a burden on healthcare systems. Actually, older people are a major emerging market that a lot of companies are very, very interested nowadays. There's various AgeWell related initiatives at SFU, Digital Health Circle, which focuses on scaling up ideas into actual products and services. And a number of AgeWell core projects, including one that Teddy Costco might talk about later, which focuses on technology for aging and mental health. And one last thing before I'm cut off, the AgeWell offers an additional support to people in this area who are trainees and students in this area. And this is called the Early Professionals Inspired Careers Program, which is specifically provided by AgeWell to anybody who is interested in this field of technology and aging. So I prepared information package. If anybody is interested, just get in touch with me, and I will make sure that this information package gets to you. Thank you.
Thank you, Andrew. So we're going to move on to Dr. Atiya Mahmood. Atiya, you're up.
Hello, everybody. I'm going to share my screen and just go over just a few things about my projects and research I am involved in. I will stay within my 3 minutes while doing it. I'm a faculty member here in gerontology, and my background is architecture and environment behavior studies. So I've been doing research in environmental gerontology. I teach in environmental gerontology, so aging and environment courses, but I also teach introduction to gerontology and beginner level undergraduate courses. So these are 3 areas that I have been doing research in. One is more housing and residential environments. The second is looking at more the neighborhood, city, and the urban design, things that were mentioned like age-friendly city, aging in place, and also looking at environment as a determinant of health. And within residential environments, I look at seniors affordable housing, also social participation in housing, as well as innovative housing options, given what is happening now around us. And with neighborhood and city and urban design area, I've been looking at age-friendly city, aging in place, inclusive environments, accessible environments, universal design, things like that, and also looking at mobility and social participation, not only for older adults, but also frail and also persons with frailty and disability. So I'm going to just quickly touch upon a couple of projects that I am currently engaged in. So if you're interested in this area, you could well, think about it and read about it. And also there are options for a lot of research training in this area. So first one I want to talk about is a project I'm doing. It's on mobility, access, and participation. And it is a research that we are doing across Canada in different two provinces, one in Quebec and in here. And we are going to look at work with different community organizations and municipalities to develop, evaluate, and implement evidence-based interventions to create barrier-free communities. So looking at all kinds of disability, mobility disability, visual or sensory disability, and cognitive disability. So there are three research streams here, looking at pedestrian environment. I was talking about the neighborhood environment I'm interested in, also transportation, and as well as social accessibility. And within this is a 7-year project, so it just got started. So students who are interested to work in this area, there is going to be quite a bit of opportunity to work on this with us. And so I am leading the pedestrian and navigation accessibility part of it. And currently we are doing projects on COVID-19 impacts with our partners. So as I said, I do quite a bit of community engaged and research or community participatory research. So we work with multiple partners in all of the projects that I'm involved in, and also looking at improving livability and walkability in neighborhoods. The second project I wanted to focus on is the Aging in Right Place project I'm working on with different community partners. Again, this is also a community engaged project. And so here we're looking at improving shelter and housing options for older adults who are facing housing insecurity, homelessness, issues like that. This is again another 5-year project, again opportunity for students who are interested to work in this area to get hands-on experience. And I am in the Vancouver lead. And so here we are looking at promising practices across the shelter and housing continuum in Vancouver, Calgary, and Montreal. So this is also a multi-province project. And the final one I wanted to mention, this is a very local project. It's called Hey Neighbor Collective. Here we are looking at systems change. It's a systems change project that brings together housing providers, researchers, local and regional government, housing associations, health authorities to experiment with and learn about ways to effectively build community, social connectedness, and resilience in the vertical community, because BC has many high-rise or low-rise, but vertical communities. So this is a project that I've been involved in with urban studies and health sciences. So I do work across different disciplines and with different departments and units in our SFU, but also work with a faculty member in UBC and faculty member in other departments across the campus. And so it is a fascinating environment to work in. So if you're interested to learn more about it, you can get in touch with me. And also, I hope that some of you are interested in this area and would like to come to our department and work with us. Thank you.
Okay, thank you, Atia. So we're going to move on to our next faculty member, Dr. Barb Mitchell. Barb, over to you.
All right. So I'm Barb Mitchell. I'm the current grad program chair. I also am jointly appointed with the Department of Sociology and Anthropology. My main areas of research focus would include families and aging, intergenerational relationships, life course research, and health promotion. I also really embrace mixed methods, so quantitative and qualitative research. And I have collaborated a lot with people from our department. So Dr. Wister mentioned that earlier, and I'm involved with the CLSA project, for example. But I also just recently completed a 4-year social science and humanities research council project. And so I've been very much engaged in working on papers and going to conferences, well, maybe not so many lately because of COVID, but essentially this project involved a Metro Vancouver study of older adults. And so we interviewed, I don't know, I guess close to 600 older adults from the greater Vancouver area and from very diverse cultural backgrounds. Because I really noticed in a lot of the research that a lot of ethnocultural groups were really being ignored. And so we really tried to get the voices of parents and families in the greater Vancouver area from many different backgrounds. So Chinese, South Asian, Iranian, for example. And what I was particularly interested in was family transitions over the life course. And so we talked to families about a number of different areas related to living arrangements and family relationships and family dynamics, relationships of aging parents with their children as well as their elderly parents, and really tried to get a sense of how certain transitions, such as those to the empty nest or retirement into elder care, were really affecting these families, and what kinds of community level services and organizations would really be helpful in terms of being maybe more culturally sensitive to be able to assist families to live their lives out in ways that were very supportive within their own relative communities. So I've always been very much interested in theory, life course theorizing, but as well as the lived experiences of families, and how can we take that knowledge and translate it into information that will be valuable to the kinds of community programs and services that want to help families live their lives out in ways that are going to be beneficial, as well as larger policy realms at more of the national and provincial level.
Thank you, Barb. Okay, now next up is Dr. Theodore Costco. Teddy, over to you.
Hey everybody, my name is Teddy, and I'm an assistant professor in the Department of Gerontology, as well as the associate director of the Gerontology Research Center that Dr. Wister had mentioned. I'm also the undergraduate program chair, and in another life, I'm still the research fellow at the Oxford Institute of Population Aging at the University of Oxford. So I thought I'd break it down into my major areas of research and then the methods I use to approach these areas, and then I'm briefly touch on some projects that I'm working on at the moment. So in broad sweeping strokes, my area of interests are in healthy aging and resilience. So how people are going to have high levels of psychosocial functioning across the life course, and also how we can foster better outcomes in the face of adversity that might be expected. And within that sort of sub-themes within those two broad areas, I'm very much interested in mental health. I trained as a chartered psychologist in the UK. Also social connectedness, looking at social isolation and loneliness, and also dovetailing with Andrew Sixsmith's work, very much interested in technology and the interface between technology and health, digital innovations, and specifically co-design of innovations with older adults. And also as sort of a side project, I'm interested in sort of the biological mechanisms that like specific inflammatory pathways to mental health. Some of the methods that I use, very much interested in systematic review and meta-analyses. I trained as an epidemiologist, so I wear a sort of traditional epidemiology hat doing longitudinal modeling. Also computational gerontology, so looking at computational approaches to data analysis, machine learning, artificial intelligence, and also touching on some of the things that Dr. Mahmood had talked about is participatory action research. So working with the community, trying to, in my area of research, looking at developing digital interventions to try and foster better mental health and social connectedness. To briefly touch on some projects that I'm working on, I have an age-well core project within the age-well framework that Andrew Sixsmith mentioned, looking at how approaches to using computational approaches and traditional epidemiological approaches to look at mental health and designing digital interventions for that. I have some funding from the Social Sciences and Humanities Research Council looking at social connectedness via leveraging technologies for social connectedness within the context of COVID. some Canadian Institutes of Health research funding to look at the Canadian Longitudinal Study on Aging, which is a study that Dr. Wister mentioned. And also within the training realm, involved in a Natural Sciences and Engineering Research Council training project, looking at collaborative research and training experiences in biodesign, and also a Social Sciences and Health Research Council consortium on analytics for data-driven decision-making. So those last two programs are ones looking at how to co-design digital technologies, and the final one looking at how to foster population-level analytical skills for trainees. And that's pretty much it.
Thank you, Teddy. Okay, it's my turn now. So very quickly, my area is aging and the built environments, overlap with Dr. Mahmood's work, but I work more in the long-term care side of things. I've been working in long-term care design and physical environmental influence on people's quality of life and care practices. Also, I do research in the community side, especially looking at dementia-friendly communities. So within these two broad areas, some of my recent projects are, we just completed a project, which was a national project, looking at a mealtime in care homes. And the mealtime is a critically important part of elders' quality of life during the day, any given day in a care home. So we looked at comprehensively about mealtime access, meal quality, social and physical environment of the mealtime aspects. And we developed a number of tools to assess the quality of interaction, quality of life, quality of mealtime experience in care homes. And this was conducted in 4 provinces across 64 care homes. We have just started a study looking at, with Vancouver Coastal and Fraser Health, looking at 24 care homes and conducting physical environmental assessment using a tool that we have developed here at SFU called Person-Oriented Environmental Tool, which is basically looking at how the physical environment can be supportive of person-centered care. And unfortunately, of course, for COVID, things are stalled now. So, but once things open up, we'll reach out and go back to those sites that we started on. We are ongoing. There's another study we're looking at in one particular care home. This is funded by the MyTax Foundation, and a student is working with me closely, is looking at how the environment can be changed to support residents' mobility within the facility and wayfinding, so that people are able to have independent mobility and participation within the setting itself. We just completed another study, was funded by SHRC, looking at people with early stage dementia living in the community and where do they go in the neighborhoods. So we don't have a lot of information about, empirically, about where do people with dementia go and participate in different programs and destinations over time. So we looked at what they were doing before, what places they're not being able to go now, and so on, and what kind of challenges people face as they're using transit and other mobility modes. We've just been invited to submit a grant application to Public Health Agency of Canada, looking at the overall neighborhood built environmental influence and mobility for people with dementia. So that's just, hopefully we'll get funded on that and work on that. So in the department, I teach the qualitative research methods course. I also teach the institutional settings, and also there's undergraduate level and a graduate level as well. So that's basically it. I know there's a lot of information. It's hard to remember everything. So I encourage everybody to go to our websites. Please go to our website, look at our bio pages, all the different faculty doing wonderful, exciting work. And please reach out to any of them or more than one of them as you feel is relevant for your research interest.